a climate that we've never seen.
The need for more innovative resources to help combat Michigan's opioid crisis is growing. That said, this isn't the only state grappling with a dramatic rise in opioid overdose deaths, especially with fentanyl heavily now on the scene.
Why is it so much scarier now?
Well, I think with the presence of fentanyl and people, people generally not knowing whether or not that is, in the drugs they are using. I think that's the scary part.
National statistics and studies, including these from the U.S. Department of Health and Human Services, show fentanyl poisoning and other synthetic opioid-related deaths are skyrocketing compared to years past. Just take a look at this chart comparing trends from 1999 to 2021. Specifically, look at that rising purple line. Dunya Barish is the director of operations for Families Against Narcotics and says today's landscape is uncharted territory, which is why intervention is more necessary now than ever, especially given the impact of the pandemic.
And addiction is a disease. At a place in the community where a lot of change hasn't been made from a systemic level on the way that we treat substance use disorder. And because of that, like an agency like ours that's why we were started.
In a sign of support, the U.S. Department of Labor announced earlier this week it's awarding $1 million to Michigan's Department of Labor and Economic Opportunity. The funds will help 24 counties across the state create more support agencies, positions, and resources like FAN.
Expanding access to treatment that is welcoming, treatment that people want to stay at, places where folks feel like they can get better, really being intentional about the services that we are providing across the state and just being able to work collaboratively.
Bear says moving forward, this work has to dig deeper. It's not just about creating resources for the sake of creating them. Resources and programming need to be better tailored, more empathetic, and evolving. All things she believes additional funding can assist with.
You walk into a cancer center and they are these, beautiful top of the notch places where people can go and recover. We would like to see, the same thing being provided to folks with substance use disorder.
Liz Lewin, Fox 2 News.